Loma Linda, California, where over millions of years, the creatures of the desert have evolved highly efficient ways to kill their prey. As the suburbs creep ever closer to the snake habitats, clashes are inevitable. Dr. Sean Bush and his dedicated team are on hand to deal with the victims. But venom comes in many forms, and today they'll be faced with a life or death decision here on the front line, home of the VenomER. An emergency is heading to the VenomER. Dr. Sean Bush and his team are preparing for another snakebite victim.
Dr. Bush, to the radio room, please. Dr. Bush.
All right, so we have a 19-year-old male at Victor Valley. Evidently, he was riding his bike, saw a snake by the side of the trail, and he got excited, spilled his bike, fell into some bushes, and he wasn't sure if the snake bit him or if some branches in the shrubbery punctured his leg. But right now, I'd like to hold off on mixing the medicine.
Okay, no problem.
Time is tissue where snake bites are concerned. Every second counts. The decision whether to go ahead with the antivenom has to be made immediately.
No history of major allergies. Make sure this is swollen.
Timothy Llewellyn's blood is drawn for lab tests, and IVs are put in.
The whole time.
I'm sorry, it's kind of a crappy place to have one, but it...
Hi there, how you doing? I'm Dr. Bush.
Hello.
What happened, man?
Well, I don't know. I'm scared of snakes. This is my first time out in the high desert. And I seen a snake for my first time, and pretty much I was going down a kind of like a mountain, so I don't want to walk through it. I'd rather just...
On your mountain bike?
Yeah. 16. And I mean, they freaked me out, and I saw one, and I was already going, and pretty much it scared me, and I put...
Did you see him strike at you, or?
No, I didn't even see him bite me or nothing. I don't even know if he bit me. I just see this.
You think he bit you?
From that, yeah, I freaked out when I saw those. You know, I didn't even feel him bite me. I just, because I tumbled down the thing and fell in a bush. My knee did too.
Let's see. Oh, you got like thorns all in you, man.
Yeah, that's why
The thorns in Timothy's leg make Sean question whether he really has been bitten. He doesn't appear to have any symptoms of a snake bite.
Was he rattling or anything?
Yeah, it was my first rattlers I saw. Well, heard.
Hey, can we get some forceps, like little forceps? Because I'm gonna pull some of these thorns out. So you went into this like prickly bush, and I mean, do you think the snake bit you? I don't think it bit you.
That whole time I did, but I don't think anymore.
Yeah.
Because I think I just pretty much scared myself about it because I reacted.
Thanks, sir.
Timothy has no swelling in his leg, but he could have been bitten by a Mojave rattlesnake. They're extremely toxic, but don't cause much swelling.
Yeah, we're gonna have to probably pick a lot of these out, and a lot of them will come out on their own, you know? I mean, a Mojave bite from just thorn punctures like that, because that may be all you get is little puncture wounds, but I really don't think this is a snake bite. Now, why did you pick these two out and think they were snake bites?
I just looked for two perfect circles, and I don't know.
As opposed to any of these other ones.
I don't know. This is my first summer out there, and I don't like snakes, and I'd rather stay away from them. That's why I think I just pretty much freaked myself out.
Well, I think that probably all this is just from getting into that, the bush with the thorns on it. I think that's all it is. Yeah. I think these are thorn puncture wounds. I don't think it's a snake bite, but here's what we're gonna do. We're gonna watch you for a couple of hours. If you get any signs of snake bite and venomation, then we have anti-venom here. We can treat you. I don't anticipate that's gonna happen. I think that you just have these thorn punctures, and that's it.
Okay.
I think he did the right thing. I mean, he had concerns that he was bitten by a snake, and if you have any concerns, if there's any question, you should seek medical care.
This is prime bite and sting season, and not just for snakes. Many different venomous creatures are active at this time of year. After his shift in the ER, Sean goes scorpion hunting with Loma Linda University's Wilderness Medical Society. Although scorpions are not a huge threat, dangerous species have been reported in Southern California. So Sean wants his team to learn as much about them as possible.
It's almost getting dark enough to see some scorpions here.
How many scorpions do you think we'll be able to see?
If the wind's not too bad, then we'll probably see dozens, maybe hundreds, depending on how long we stay out here. All right, let's go off and look for some scorpions. Definitely watch your step out here. I don't want you guys to step on a sidewinder for sure. That would be bad.
The students have to be careful where they put their feet. There could be snakes out here.
Flip your black light on.
The best time to see scorpions is at night, with the use of ultraviolet black lights, which make them glow in the dark.
Yeah, good call. You said you'd be the first one to see one. But that's how they light up.
Wow, that's amazing. That's incredible.
That's hard to...
It looks like it's plastic.
Oh, wow.
See, he's all defensive now.
Which type of scorpion is that?
That's what they call the California sand scorpion.
So that's not the really big one you were talking about?
No, the big one is about 4 or 5 times that size.
How would that look without the black light on?
Well, let's check it out.
Oh, wow.
Oh, wow. Just disappears.
It's so camouflaged, you can't even see it.
Ooh, we got something. Did you see that?
Yeah.
Something came across his path, and it looks like a little bug.
Oh, wow.
So he got a little predatory
Did he
behavior.
sting it?
No, he didn't sting it.
Just,
Oh,
it just
there
got
it is.
away.
Oh, yeah, it just did.
All scorpions will glow like this.
Yeah.
Is that right? Really?
Really?
Yeah.
What is it about the exoskeleton that's like that?
It's something about the way the exoskeleton hardens, and it's just the way it is. And some people speculate it's to help the scorpion avoid daylight, but no one really knows, to be honest.
Years of experience have taught Sean how to handle scorpions safely, but his students are careful not to touch them.
It's like walking on ice.
All right, I'm gonna cut this guy loose. Is that all right?
There are around 90 species of scorpions in the U.S., but only the bark scorpion has venom potent enough to be considered dangerous to humans.
How commonplace is scorpion anti-venom?
Scorpion antivenom isn't even available in Southern California. It's only available in Arizona, and they stopped producing it. The people that produce it there no longer make this antivenom for scorpion sting. So right now, we're in need of a new scorpion antivenom.
Venom is widespread in the animal kingdom, but medicine has few antivenoms. Sean's team have Crofab for snake bites and an antivenom for black widow spider bites. It's not perfect. 24 hours later, and the night shift are on duty at Loma Linda. It's nearly 3 o'clock in the morning, and they have a case that's concerning them. 12-year-old Josh Shetley has been transferred from another hospital with a black widow spider bite. His mom, Debbie, is very worried. The team has to call Sean. It's a serious case, and it's going to be a difficult night at the VenomER. 12-year-old Josh Shetley has been bitten by a black widow spider. Dr. Bush has been called in to see him.
Hey, where's the patient?
Oh, floor 5.
All right, thanks.
Josh has been transferred from the ER to the pediatric ward.
Good morning, Devaney. How you doing?
Pretty good.
Thanks for the call. How's the patient doing?
Sean is briefed by Chief Pediatric Resident Devaney Teal.
Other hospital, but feeling a little better now.
Good.
Still has some swelling and flushing.
Josh was bitten as he was putting on his shoe more than 12 hours ago.
Hey, Joshua.
How y'all doing? I'm Dr. Bush. Hey, I heard you got a spider bite, is that right? How you doing, man? How you feeling? You felt better, huh? Tell me the story, what happened to you?
My sandals were in the house
Yeah?
where the toys were, and I got them when I was walking. And right when I put my foot outside, I felt a sting go into my foot. Then I ran inside to my mom, and it was a black widow that stung me.
Okay. Well, where'd he get you?
My foot?
Let's see, this foot?
Mm-hmm.
Can I take your sock off there?
It's between the last 2 toes.
Move this out of the way. Between these last 2 toes.
Mm-hmm.
I'm sorry, buddy. Oh, yeah. Now look at this. This is classic right here. It has sweating just locally, and that's classic for black widow spider venomation. So this is definitely a spider bite. And you can just barely see a little mark. And there's a little area of blanching around there, and then there's a little redness around there. It's like a bullseye.
At first, okay, on the way to the hospital, he was complaining of cramps, and he was dry heaving, like wanting to throw up, but he couldn't throw up. And then we got to the hospital, and his nerves and everything were just shaking, you know, like his legs first, and then his toes, and then, you know, he was real antsy, and he moved around. He said he was in a lot of pain, and they gave him morphine right away.
Does it feel like you have cramping in your stomach?
Mm-hmm.
Can I take a look at your stomach? I'll touch it real gently. I won't push hard, okay?
Mm.
It hurts to touch it all. You still in quite a bit of pain? On a scale of 1 to 10, what would you say your pain is? With 0 being no pain and 10 being the worst pain.
8.
It's about an 8. And his eyes aren't normally that puffy, are they? Yeah.
Josh shows all the signs of black widow spider envenomation: swollen eyelids, sweating, and abdominal pain.
I want to just confirm the spider. Do you
It's
have the
right
spider?
there.
All right.
Was alive when they came in, and
Yeah, looks like a black widow to me. You can look at the legs, and these spiders don't have hair on their legs. Yeah, that's a black widow, sure enough. And his symptoms are classic. I mean, absolutely classic.
Black widows are among the most venomous spiders in North America, and it's the females which are especially harmful to humans. They only inject a tiny amount of venom, but that's all it takes for someone to become really sick. It's particularly dangerous for children and older people to get bitten. There is a black widow spider antivenom, but it's risky to give. There's a 25% chance of the patient suffering an immediate allergic reaction.
I guess you already heard a little bit about the antivenom. The antivenom effectively cures black widow spider bite. I mean, it totally takes away the symptoms within about an hour after the infusion goes in. But the problem is there's risks, there's side effects. In fact, there has been a person killed by the antivenom. There has only been one person documented killed by a black widow spider bite.
Okay.
So that, like I said, there's pros and cons. It totally takes the symptoms away, but you got to take a little risk there.
Yeah, this risk is a big one.
Absolutely. Your alternative is to not use the antivenom and instead to just rely on pain medications and sedatives. And if that controls the pain, then you can just tough it out through the course of the envenomation, and it could take days, possibly even weeks, but it should get better as each day goes by.
Okay.
But it's your option. I think antivenom would be appropriate. I think that just pain medicines and sedatives would be appropriate too. Now, another thing I want to tell you about the antivenom is we can give it really late. We can give it days after the spider bite. So if you change your mind, and if it looks like he's just having ongoing pain, we can give him antivenom at any time, and it'll solve the symptoms.
Okay.
And ultimately, the decision is yours to make.
And how long would this take for him to weather it out?
Days to weeks.
So he'd be in here days to weeks?
At some point, they'll get his pain under control with medicines that he takes by mouth. At that point, he'll probably be able to be managed at home as opposed to in the hospital. But until then, I recommend keeping him in the hospital.
Because he wants to go home.
Yeah. Well,
He wants to go home, and we've got other kids at home, you know, that we need to get home to. And if he can do that, then that's fine, okay? I just don't want him getting sicker, okay? I don't want him having all these machines hooked up to him or anything like that. That's my worst nightmare. But you can.
Well, that's the big advantage of the antivenom, is we can discharge him home right after that.
Okay, let's try it. Because I want to take him home. I want to be here. He doesn't want to be here. He wants to go home. He wants to be in his own bed.
Well,
So,
and like I said, it's not a decision you have to make right now. I just want you to be informed of everything.
I'd like to try it today when everybody is here. You know, let's do it.
You want to talk to your husband a little bit more? I know Dad was pretty active in the decision
Yeah.
too.
Yeah, I think I will. Yeah. As long as there's tons of doctors working on him, I'm fine with it. I'll be right back.
It's an incredibly difficult decision for a mother to make. Debbie wants Josh to get better, but she doesn't know the best way forward.
He's coming. He said, yeah, let's do it.
He wants to do it? Okay. In that case, we'll arrange an ICU bed,
See what we can do, okay?
and we'll get all set up for that, okay?
Are we going to be able to be in the room? Would you do that with him?
Absolutely.
Okay.
Absolutely. That's fine with me.
Okay.
52, this is Vincent. How may I help you?
The pharmacy is open 24 hours a day, but calls for spider antivenom are rare, so the hospital only stocks a few vials.
Hey, Norm.
Hey, Sean, how's it going there?
Good.
The doses we had talked about, the last 2 vials are all ready to go.
Thanks.
Debbie worries she's made the wrong decision. Will she change her mind? Find out when VenomER returns on Animal Planet. Josh Shetley is still in a lot of pain after being bitten by a black widow spider. His mom, Debbie, has decided to go ahead with the antivenom, but she's scared she's made the wrong decision.
I feel helpless. And I'm gonna leave it in this doctor's hands, so hopefully he'll be able to help him. I just hope and pray to God that he's one of the kids that, or one of the people that can take this antivenom.
At first, I didn't think she was gonna consent to giving the antivenom, and then she changed her mind and decided she wanted to go ahead and give it. So, to be honest, I'm quite nervous about it. It's a very scary medicine to give. People have died from this medicine, So we're gonna make all the preparations and precautions to make sure that we give this safely.
While the staff makes arrangements for Josh to be taken to the intensive care unit, Sean gets a call from the pediatric ER. There's another suspected spider bite, and Dr. Jim Moynihan wants him to check it out.
Hey, how you doing? I'm Dr. Bush. I heard you might have had a spider bite, is that right?
8-year-old Alicia Atherley has a wound on her arm, and her mom thinks she may have been bitten by a black widow spider.
No, all I do know, that what made me think it was a black widow is that, like, last night I was cleaning the room, doing a thorough cleaning.
The wound looks worse than Josh's, but Sean knows Alicia hasn't been bitten by a black widow. She doesn't have any of the symptoms Josh has.
Yeah, I just ran real fast underneath some stuff, and I couldn't get to it. But she said this happened, it started hurting at school, is what she said, and she went twice to the nurse. And they just rubbed something on it, then all of a sudden it just started inflaming. And it was dark purple around the outer and inside.
It doesn't really look like a black widow spider bite. And black widows can't run fast like that.
Okay.
So it could be something else. Other spiders can bite you and cause you to have swelling. But did you see the spider bite her, or you just saw it running?
I just saw it running. That's what made me thought that maybe, you know, it was some kind of...
Well, she's got some sort of...
But it just started hurting at school. She said, like I said, she went to the nurse twice. And then it didn't start getting big till she got home. And then we got home and...
She's got some sort of inflammatory response here. It could be an infection. It's hard to tell right now. It could be a little bug bite. But I don't think it's a black widow. But we're gonna watch it. We're gonna watch it for a little while, see how she progresses. This all started at what time?
When we were probably, I would say around 10 or 11.
When I went out.
This morning?
Yeah.
And it's gotten gradually
worse?
worse?
It was worse. I mean, it's starting to get a little better, actually. When we first came in, it was like literally, you know, it was really dark brown here, dark black here, and then on the outer it was black too. And it was puffed out more. Now it looks like it's pussing up a little bit.
Yeah. Okay. I mean, it certainly could be a, you know, bug bite or some sort of arthropod bite.
Start with some Benadryl and see how she looks?
I just treat her symptomatic, yeah. Maybe even some antibiotics just in case it's an infection.
But what do you think caused that blister part there? Because she said that it was black at first and then it had this blistery part now.
It kind of makes me think of like staph or strep. It almost looks like a black widow spider bite because you get the little halo. There's central area, there's a little halo of white, and there's a little halo of red, but it's not classic.
But do you ever see it in kids without the abdominal pain? See, all the kids I see with black widows, you can just see the tummy just wiggling around.
Yeah.
From the muscles just spasming out.
Exactly. I mean, usually they get like cramping in the arm, and then cramping in the chest, cramping in the belly. She didn't have any of that. And it's been since like 10 or 11 this morning, so I would expect that to have developed.
Alicia will be okay, but despite heavy medication, Josh is still in a lot of pain. His dad, Matthew, has arrived, but is having second thoughts about giving the anti-venom. He and Debbie don't know whether it's worth the risk.
And nothing goes wrong. Here he is right here.
Hello, you must be Dad.
Yep, Dad.
Dr. Bush.
Yeah, I know
Nice to meet you, sir. All right, so y'all want us to go ahead with the anti-venom then, huh?
He needs it, right?
Well,
you're the expert.
I was telling your wife there that there's pros and cons of giving it. There are side effects. Are you familiar with bee sting anaphylaxis? You know how when someone has an allergic reaction to a bee sting, you can have problems really fast. Well, that's kind of what can happen if we give him this antivenom and he has an allergic reaction to it. He can have trouble breathing, but we'd give him medicine for that.
Okay.
It'll totally resolve the symptoms from the venom. But there is that chance of allergic reaction. I told your wife there has been one patient killed by allergic reaction to the anti-venom. There's also been a person killed from black widow spider bite as well. So it's a tough decision. At the same time, it totally takes the symptoms away after a vial or possibly two. And it'll be so good. He'll feel so much better. He'll probably be able to go home shortly after that, maybe first thing in the morning.
Okay.
So that's the decision we're faced with.
We have to do it, babe.
Okay.
Because right now he's in pain, right? He won't get better right now, right? Is that what you're saying?
Well, it could take days or even weeks for the pain to get totally better. He seems like he's getting gradually better, but it's going to take a while. He'll be in the hospital probably for a couple of days, getting over the pain until we can get it controlled.
Okay.
I mean, that's a grade 3 envenomation. That's a severe bite. So,
It's a tough decision for Josh's parents to make, but it has to be their decision.
Yep.
Okay.
Let's do it.
Well, we're gonna move him into an ICU bed. I'm gonna get the anti-venom and mix it, and then we'll give it very slowly over the course of an hour. Watch him really closely for allergic reaction, and if he tolerates it, he should be getting better pretty quick after that.
Okay.
Although it's Debbie and Matthew's decision to go ahead with the anti-venom, it's a huge responsibility for Dr. Bush. This is a risky medicine to administer, and he's going to need his whole team around him. Josh is being transferred to the Pediatric Intensive Care Unit. They have the specialist equipment that will be needed if Josh does suffer an allergic reaction.
Okay, thank you.
Thank you.
The anti-venom may provoke anaphylaxis. This is where the airways become swollen, making it difficult to breathe. It can also cause a dramatic drop in blood pressure, which can prevent blood from reaching the brain or vital organs. If this was to happen, he could die.
The worst case scenario is he could have an anaphylactic reaction to this medicine. If he does, his airway could swell up. We could have to put a tube down his throat to help him breathe. We could have to give him epinephrine. We're going to prepare everything. In fact, with Crofab, you have to hurry to give the antivenom because time is tissue. But with this, you got to make sure you're making the right decision. You wait. You make sure everything's prepared before you start this medicine. And so what we're going to do is I'm going to have the PEDS IC resident at the airway. I'm going to have the other PEDS resident ready to do procedures. I'm going to have the nurse at the bedside giving medicines. And I'm going to sit at the bedside until this stuff gets all the way in.
Here's your pies, baby.
Debbie takes a few quiet moments to pray with Josh before the infusion begins.
Epinephrine, and then if something happens, epi airway. Stop infusion, epi airway. She'll be with the epi, you'll be with the airway, and you'll be helping us with the airway. This is the antivenom for black widow spider bite, and we don't mix this stuff too often. I'm just gonna inject the contents of this vial into this bag, and then we'll be ready to get it.
An IV will be put into Josh's arm so the antivenom can get directly into his bloodstream. This is distressing for everyone, especially Josh.
You want to stick that whole thing in my arm?
No, it just looks bigger than it is, okay? It looks bigger than it is. Relax, relax.
Just look over here with me, okay? And we're going to be all done after this.
No.
Breath. Come on,
Keep
honey.
breathing, honey. Deep breath.
Almost done. Almost done, okay?
Oh, honey, take a deep breath. Okay?
All right, looks good.
It's all in.
There you go, perfect.
See how much easier that was? Good deal. Take a nice breath for me.
Good job.
You okay?
Mm-hmm.
All right.
Good job.
Good job, Josh.
That's the hardest part, huh?
Yeah, that was it. It's done. Sorry about that, buddy.
Okay. Thanks, Dave. Bye.
The anti-venom is almost ready to go. The team is careful to explain to Josh what is happening, so he's not so scared. They're impressed with the way he's coping with the pain.
That's the stuff. You can hook up your tubing. Hey, Dave, did you bring that stuff? All right, thanks. Perfect. Perfect. You got skin hooks? Okay, that's just in case. Can you stand by? You have a few minutes?
Yeah.
Okay. And once the infusion starts, everybody will stand by for like 20 minutes.
Again, this is all so professional.
Devaney tries to reassure Matthew and
We
Debbie.
have everything ready, so we don't need any of it.
Would he be feeling any of that?
No. He would have medicines. If it were to come to that point, he would have medicines both to make him sleepy, to make him relaxed, and to make him feel no pain. Okay? But again, don't anticipate to get to that point. Okay.
Yeah, we're not going to get to that point.
That's right.
It's going to take, and he's going to get better, right?
Better, and then we can eat breakfast and go home.
So, airway, alternative airway, meds, we're all set. We're set for everything. If this goes in as planned, he should have no problems anymore. He should be done with the spider bite. He should be able to go home, go to school, eat normal stuff.
The infusion begins.
Josh, how's your pain right now? What's your pain rate right now out of a scale of 0 to 10?
7.
It's about a 7.
Will Josh have a reaction to the anti-venom? Find out when VenomER returns. Josh's infusion of anti-venom is underway, and everyone is holding their breath. They should know in the first few minutes if he's going to have a reaction to it.
But
Okay.
1 cc a minute?
1
for 10
cc per minute for
cc's.
10 minutes.
Sean has the whole team on standby in case Josh suffers anaphylaxis and his airways become swollen. Each member of the team has a specialized role. This is a huge learning curve for them. It's rare for spider antivenom to be given.
Let's just double check everything. Josh, open your mouth, okay?
Turn your head back towards the middle here.
Say, ah. Tilt your head back. Let's look
All the
in
way
there
back
one more
like before,
time.
hon.
Airway looks fine. It's not-
List of your lungs here.
Big breath, Josh.
Josh, we're gonna keep this up, okay? Keep an eye on your tummy here. There's 2 types of adverse reactions to this antivenom. One is the immediate adverse reaction, which is the anaphylaxis that I've been talking about. But he can also have a late reaction up to 3 weeks out after the antivenom's given. That's called serum sickness. And that's just basically an itchy rash, swollen lymph nodes, joint pain, low-grade fever, and you just treat that with Benadryl and steroids. And that usually resolves in about a week. Say ah. That all looks good in there.
The most dangerous part of the infusion is over.
10 cc goes in, we hadn't had anything suggestive of an acute adverse reaction. But here's the other part where you gotta watch real close because we just increased the rate to 240 cc's per hour. So the 10 cc.
Josh is still at risk. They've just increased the infusion rate. Debbie thinks she spotted a rash on his stomach. Sean's concerned this could be the start of an allergic reaction.
We gotta check you, buddy, okay?
Hey, Josh.
It's important. We need to take a look.
Are you feeling itchy anywhere?
No.
Okay.
The antivenom goes in, and there's no reaction.
You want to take a listen to him, Dave?
Sorry, honey, just looking at your chest, that's it.
I think we're looking pretty good here, huh?
Yeah.
Hey, can I look in your mouth one more time, Josh?
Can I go to the bathroom now?
Josh is feeling better.
We'll step out and let him use the urinal, but I don't want him off the monitors.
Yeah, you gotta stay in bed, though, and you gotta use
Now I'm relieved. I don't think he's going to have an allergic reaction. But I was quite nervous at first. I have a lot of trepidation before giving a medicine like that.
Debbie and Matthew finally feel like they can breathe again.
Happy, very ecstatic.
Yes.
I'm happy. I'm relieved, tired, all in one. I'm exhausted now.
You know, as a parent, I didn't think it was really that bad at first, you know, because it seemed like he was getting better, you know, and then it's just weird how a spider bite can do this to somebody. Just a spider. You never think it couldn't happen.
Half an hour later, Josh has finished his infusion of antivenom, but the nurses are having trouble waking him.
Okay, bye. All right, is it all in?
Just what's primed in the tubing.
Okay, good, so it's in. Hey, Josh. Hey, Josh. I'm sorry to wake you up again. It's just me bothering you again. Here, let me wipe your head down here. Still a little sweaty there. How you feeling? Besides being real sleepy. Hey, Josh. How's your pain now on a scale of 1 to 10? Do you feel it?
Unless Josh responds, Sean won't know if the antivenom has worked.
Hey, Josh. Sorry to keep bothering you.
Until then, the danger is far from over.
Josh?
Josh has had his infusion of antivenom, but Sean is having trouble waking him.
Hey, Josh. Sorry to keep bothering you. Just you tell me how your pain is, and we'll... Here, sit up for a second. Sit up.
That's it. Good guy.
Sorry about that. How you doing? Tell me, on a scale of 1 to 10, do you still have pain? Do you have any pain? On a scale of 1 to 10, what is your pain? Josh, are you still hurting? I'm sorry to wake you up, buddy.
Here, relax your arm for me, because you got that IV going in there.
I gotta ask you this question because I gotta know, because If you're still having pain, we might have to give you more antivenom, but if you're not, then we're done. But I want to know, it's important. Josh,
Wake up, buddy.
are you still having pain? Yes or no?
No.
Not at all? You having no pain at all? Sorry, he's dozing off, but I don't think he has any pain.
No, I don't either.
Okay, we'll let you sleep then.
Lay back down. Lay back down.
Sorry about that, buddy.
Oh, he wouldn't even let you have touched his foot like that before
Yeah,
at all.
I'm manipulating his foot here pretty hard. He's letting me just totally touch it.
Yeah.
Doesn't hurt down here anymore, Josh? Evidently not.
No, he was practically jumping off the bed, so.
Okay, good. Giving it a good squeeze, tweaking the toes. You okay? All right. I just want to make sure we don't need to give you any more medicine. I'm very pleased. I mean, now it doesn't seem like he has any more pain. And before he was telling me he had 8 out of 10 pain. And you could see he looked miserable. I mean, he was sweaty. And anytime you touched him on his foot or his leg, he would just jump and wince in pain. And now he's letting me touch him wherever.
I'm happy, real happy. Yeah, if he can make that, that's what he did to you.
Yeah, he said, I'm gonna let you back to sleep. He went, all right.
He agreed with that.
Yes, he did.
As Josh sleeps and his body recovers from the trauma of the spider bite, the day shift is back on duty in the ER.
Take the whole 9 out, or go up with 9. I'm a DNR.
9 hours after he was given the antivenom, Josh seems to have made a miraculous recovery.
Morning, Josh. How you doing, man?
Way better.
Hey, you look way better.
My foot don't hurt no more either.
Really? Let me check it out.
Go ahead.
Because last night you wouldn't even let me touch this foot. Today I can't even see the bite wounds hardly anymore. This doesn't hurt at all, huh? You can wiggle your toes real good. Oh, that's outstanding. Nothing hurts up here. Tummy doesn't hurt. Chest doesn't hurt. You still have a little puffiness, but it looks so much better than it did last night. His whole top lid was swollen. Looks much better now. So, do you have any pain anymore?
No.
After that medicine went in, it was totally gone, huh? Good, good. What do you want to do now?
Eat.
You want to eat, and then what do you want to do after that? Go home? Well, good. I think we'll let you go home pretty soon here. Do y'all have questions so far?
Nope. I got a question. How does the antivenom work?
Okay. Antivenom works by, it gives you immunity to this spider's venom. So the antivenom binds onto the venom, inactivates it, and then your body eliminates that. Josh, what do you want for breakfast, man?
Steak and eggs.
Steak and eggs. I don't know if we can accommodate that. Is there any, what's your second choice?
Pizza.
Pizza. Wow, let me go see if we have any pizza. I'll go see if I can round some of that up.
What is it, Josh? Enchilada?
No, I think it's lasagna.
Not quite the meal he was hoping for.
Only one pea at a time. How's it doing? Are you feeling okay? Going down? Not feeling nausea or nothing?
No problem bearing weight on that foot? Does it hurt? Nothing. Well, there you go. You're good to go then.
So you can walk out of here.
Take a couple of steps for me if you can. Looks good. All right. You can sit back down.
You can keep my lasagna.
You don't like the lasagna?
Oh, it's okay.
Well.
I'll eat it.
Tastes like dog food.
It's been a traumatic 24 hours for Debbie and Matthew. Only a parent could understand the anguish they've been through. But Sean is about to encounter the powerful bond between parent and child for himself.
Your baby weighs 10 ounces.
Wow!
His wife Amy is having the first ultrasound of their baby. Amy's mother has come along to share the special moment.
It's a little bit bigger than... I'm so thrilled because I did have one concern that we would end up having a snake. And so I'm just glad to see that it's a human and that it's a child and it's not venomous in any way, that just makes me very happy. Of course, you know, since we don't know if it's going to be a boy or girl, we thought, you know, maybe just naming it Viper until it comes out with a nice boy or girl name.
The proud dad hopes he or she will inherit his interest in snakes.
Snakes will be definitely a part of the baby's life at some point. And he or she will have to either accept that or choose something else.
Granny.
Or go live with Granny.
That's right. I'm just actually looking to see if I could see the sex of the baby because I want to know.
I don't do it while
Ultrasound tech Stephanie Lichty is a friend of Amy.
Don't look.
Don't look, honey.
Oh, okay, I'm not looking.
Honey, don't look.
Okay.
Sean. Did you look, honey?
I wasn't looking.
You got a smile on your face.
I
think Sean knows
I honestly
something.
didn't see.
You don't know?
But even if I did know, I would totally lie and say that I don't know.
You honestly don't know, but you were going to lie to your wife.
No, I
I'm so
honestly
confused.
don't know. Stephanie's been moving
I
so
just
quick.
want to be surprised. I want us both to be surprised.
On the venom frontline, the human body faces many onslaughts from the forces of nature and puts up an incredible fight. Antivenoms do save lives, but scientists still have a long way to go to perfect them. Perhaps the dawning of new life makes the perseverance all the more worthwhile.
Proud moment, huh?